Support for this program is provided by the Foundation for Excellence in Louisiana Public Broadcasting and from viewers like you.
Welcome to Louisiana Public Square. I'm Beth Courtney, president of LPB. Tonight we'll be exploring how the coronavirus has disrupted the state's favorite sport, football, and how football has played a role in nearly every major policy issue facing the state. Joining me to moderate is LPB's managing editor of Louisiana, the state we're in, and former sports reporter, Andre Morrow.
Hi, Beth. Good to see you and great to be here. You know, this year, maybe more than any other, Louisiana fans have been looking forward to football season, coming off an LSU National Championship, a chance to escape from the stresses of living daily through a pandemic to a happier place of competition and camaraderie and cookouts and tailgatings. But alas, COVID-19 has caused a delay of game.
Well, Andre, no tailgating, reduced attendance, shortened seasons. These are just a few of the changes Louisiana spectators and athletes are facing this fall. Over the next hour, we will hear how the coronavirus has changed high school, college, and professional football in the state. We start with Eunice High head football coach Andre Vijay, whose predecessor had to retire due to COVID concerns.
Coach Paul Trosclair was my coach actually when I started playing my junior and senior year. He was our head coach. He was over here for 25 years. He had cancer, a rare bone cancer that he survived. He's a cancer survivor. And with the COVID-19 outbreak, he was at high risk, and that's why he deemed that he needed to retire. We went into the summer with all these protocols. We couldn't use a football. We couldn't, run any plays because we couldn't be close with each other. It was very challenging. We don't force any of our kids to play. There's some decisions that they made, but then when we got the okay that we could start practice, I tell you what, everybody was there. I mean, they were so ready to go. We got to take temperatures every day. We monitor these kids on a daily basis. Only a certain amount are allowed in here. You know, like our pregame meals, we only feed like the guys we know that's going to be playing. You know, I hate to make kids feel left out, but at the same time, that's just the situation we're dealt with. You know, this summer we had a player that did test positive, and we had to shut down for 2 weeks. When we started the first week, they were so excited. You know, we had a limited amount of fans, but I tell you what, the fans that were there, they made some noise. Their emotions were high. I thought they responded well. You know, we set a school record for point scores. I've said prayers all summer to give these guys a chance. I'm so glad that they gave these players a chance to play. You know, even now, recruiting-wise, college coaches can't even come to your campus. So I think we have a few guys that would have an opportunity to play college football, and right now I think they might miss out. And, some schools, more than us, this football funds their whole program, their whole school, and not just the football program, but baseball program, basketball program. So some people are struggling, It's kind of stressful because you don't know what the finances are going to be as compared to as it was other years.
Joining us in the studio to share their football stories are Eric Held with the Louisiana High School Athletic Association, that's the LHSAA, Dwayne Jenkins, who is athletic director and football coach at Lutcher High School and also president of the State Football Coaches Association, and George Hart, a senior running back for Catholic High School in Baton Rouge. I want to thank everyone for joining us for this discussion. And Mr. Held, I'd like to start with you. We just heard about how coronavirus forced Coach Paul Trosclair to take early retirement due to health concerns. Do we know how common that this is in the state? Have high school coaches in other sports had similar situations?
First, thanks for having me, Andre, and LPB as well. Appreciate being here to represent the LHSAA and LHSCA. It's unfortunate with Coach Paul at Eunice, who's a legend, who's a future Hall of Famer, has won a couple hundred games in his career, that we see this. It's unfortunate that we've lost him. He's not on the sidelines with his team. He's been a fixture at Eunice High School and in prep football throughout the state. As far as we know, talking with Dwayne and other coaches out there, that this is the first we've seen with football It's the first we've seen with any of our fall sports, volleyball, cross country, and swimming as well, that are competing right now in the fall. Talking with our colleagues around the country, it's happened in a handful of instances in other states where you have coaches who are up in age, over the age of 60, also with pre-existing conditions, of course, that we've seen COVID unfortunately attack those people 60 and over. Those are at high risk, of course, that we've seen. But Coach Paul is really the only one that we know of in our state right now. We've seen teachers in some of our 70-plus school districts around the state take a sabbatical due to this, and those who are close to retirement or those who are of retirement age or in drop or that have decided to come back and teach after 33 years. We've seen some of those teachers, but as far as coaches concerned, this is really the first of its kind.
Well, let me ask you this. During the special session, lawmakers tried and failed to restructure the association due to public outcry for delaying the start of the football season. I know you heard that. What are your thoughts, though, on this move, and why was the decision made to postpone the season to begin in October?
Sure, Andre. So going back in March, mid-March, when it was shut down with the spring sports, Mr. Bonine and the LHSA Executive Committee made the unfortunate, painful, but the correct decision to shut down spring sports. Getting into April, we started to talk about how we were going to structure and return to play for our fall sports, and of course football being the main one. Talking with Dwayne, who was then the president of the Coaches Association and of course president of the Football Coaches Association, our football advisory committee, superintendents throughout the state, the Department of Education, Dr. Greg Stewart at Tulane, who is the head of our Sports Medicine Advisory Committee, and also returned to play for the American Athletic Conference, consults with the NFL and other pro leagues as well, the state legislature, and having a relationship with all of those. Mr. Bonine does, and does a tremendous job leading our athletic association. And there were steps along the way, April, May, June, getting to where we could practice again in June, on June 8th. Our school administrators, our athletic directors, and our coaches who are boots on the ground with our athletes, they've done a tremendous job ensuring the safety of our kids when they return to campus, making sure that equipment's sanitized, that there's a safe environment for our student athletes. And then moving forward, of course, the outcry every month, every week, every day was, hey, when are we going to get to play football again? So making sure that our student athletes had a safe environment to return to play. And then also, because of a legislative act at the time and because of phase 2 under the governor's phase plan, not allowing for contact to be made, contact sports to be played, that is, those were some hurdles we had to overcome. Of course, at the end of August and leading into September, the Attorney General, the state legislature got together with Mr. Bonine and were able to work it out to where we could move forward to where football could be played. Of course, the first week of October allowed for scrimmages, and then the first week of an 8-game regular season began the second week of October. So it's been a long path as far as getting there, all the way going back to mid-March and working our way to there. A lot of hands have had a play in returning to play for football.
So it sounds like super heavy involvement has been going on. Coach Jenkins, let me ask you this. What health concerns have you heard about from coaches, parents, players about the pandemic, and how are these being addressed?
Well, I think the first thing was you kind of had two sides, and that's what we've kind of seen. Unfortunately, across our country, everything gets divided into two sides, and everybody picks one. So I think the challenging thing that a lot of coaches, a lot of athletic departments had to go through was trying to navigate that when you had some people that were ready to return full speed ahead, and you had others who were very cautious about the impact that COVID had. So for a high school football coach and athletic administrator, our job was to put procedures in place to try to ease some of those concerns. So it was really a lot of planning on the front end, seeing what those best practices were from professional leagues, from the colleges, and what were best practices around the country, and develop plans that could ensure the safety of the student athletes to their parents. And that was kind of the first step. And once we were able to put a plan in place, parents were able to make a choice. And for the most part, the majority of parents saw the effort that was being done by high school coaches across the state, and allowed their kids to rejoin and start working out in June 8th. And it was a gradual process. When we started in June 8th, we were in groups of 25. And then we built through the summer to where by August we were able to get some groups of 50, still being in static groups, and the daily temperature screenings and just being proactive and not being afraid to send a kid home if there was some symptom just didn't feel right, and let time pass. So I think once we were able to do some of those things, it eased some of that concern for both parents, administrators above us in the schools, and for the student athletes. But I think overwhelmingly you saw just so many people were just excited to get back, to have some sense of normalcy in this crazy world that we're living in right now.
Yeah, it is crazy. George, crazy for you also as a football player. What concerns did you have and did your family have about you playing?
The concerns that we mainly had, I mean, like at the time when we first heard we'd come back, it was a new virus and we didn't know much about it. So like they were concerned with like me catching it and like possibly me bringing it home to them and them getting sick. So like they weren't as concerned once they figured out the precautions and stuff Catholic had put in place, because they knew they would take good care of me and make sure that I was safe throughout the whole practice and all that.
So that's a big change.
Yeah.
What are some of the big precautions that have been going on a regular basis for you?
So starting back in the summer, like we had to do like contact tracing between each group. So like each position group had like a different color assigned to them. So like if the running backs, we had black. So if like one of the running backs had it, all the running backs had to sit out for the 2-week period. And then like coming into like a more like current time, we all have to wear a mask in the locker room. Only like a certain amount of people can lift at a time. And even like going to games, we can't bring everybody anymore. Like all the JV guys can't come. Only like a certain amount that know will play could come and stand on the sideline to kind of keep everybody spaced out.
Is that something that's being followed though on a regular basis?
Yes, sir. Like mainly everybody stays spaced out on the sideline, just because we know we all want a season, we all want to play. So it's a big priority to us.
All right, George, thank you so much. I appreciate that. Mr. Held, how does the process work if you have a student or parent who doesn't want their child to play because of health concerns? And are you seeing this happening very much as this process goes along?
Well, first of all, the LHSA, one of our core values is to ensure the safety of each student athlete, and that goes to each school, our 405 schools that operate under the LHSAA. When a parent decides to send their child to a school, I think it goes without saying one of the reasons why they send them there is they feel comfortable, they feel that their child's safe, they feel that that school is going to take care of the best interests of their child. So from an administrator, an athletic director, a coach standpoint, I think our school personnel has done such a great job taking care of our student athletes. So I think it sets a parent's mind at ease when they send their child to school, that school is doing such a great job. And because of that, we've seen very few student athletes that have decided to opt out or not play due to COVID. I think our school personnel has done, as Dwayne has mentioned, they've done such a great job with temperature checks, social distancing. You've heard George talk about the small pods. We've heard about the static groups. And our schools, our coaches, our athletic directors, our administrators, they want to ensure that their student athletes are safe, of course, but they also want to make sure that they're able to compete, because that's part of the school experience for a high school kid.
It's been a challenge, to say the least, right?
It's definitely been a challenge. We've heard leading up to June 8th, when we were able to get back on the practice field in those small groups, we've heard many questions. We've had a lot of Zoom meetings where coaches would get together and share information, and that's the one great thing about our coaches in the state. They don't have big egos. They're willing to get out there and share information and talk about how they're going to keep their athletes safe, share ideas, strategies on how they're going to do that, and also continue to get the most out of their practices, not only on the field but in the weight room and even in meetings, and strategies to keep kids safe in the locker room as well.
You know, college football players are getting tested for the heart issue, myocarditis, before and after they play. Are there any similar concerns or testing going on with prep players?
Sure. I think back in July that became a big concern. That was kind of a buzzword out there, and a big reason why the Big Ten, I believe, had a concern with returning to play, and of course the Big Ten's returned. Dr. Stewart, who's an expert in his field and returned to play with the American Conference in Tulane. He heads our SMAC committee, and that was a concern of his at first. And then he and a lot of the other medical experts that we use got together and put our minds at ease. And a lot of our schools, they incorporate heart screening into their physical. When a student gets a physical, they must have a physical in order to compete at any school of the LHSA in order to compete in that sports season, and to have their parents sign a parent permission form as well. So again, a lot of our schools, our school districts are doing things like that with heart screening. A lot of that with the myocarditis. We see that, again, with COVID, the small number of students who test positive for COVID, 18 and under, very small percentage, and then even more so, it becomes a minute percentage when it talks about myocarditis. So have we looked at that? Absolutely. And we've had a lot of medical experts that we rely on with our sports medicine advisory committee that have kind of put our fears to rest, so to speak, when it comes to that.
Okay, George, let me ask you this. Has this pandemic changed the way the college recruiting process has gone for you?
It has a lot, just mainly in like we can't meet face to face anymore. Like a lot of conversations I've had with like college coaches have been like over the phone, Zoom meetings, and like even like I remember one college they had me like on a Zoom tour of the school. They had a PowerPoint set up and they had like videos for me just to watch. Like they took me through the school, all the buildings and stuff. So that's like the biggest change I've seen.
That's definitely not what you expected when you expected your recruiting process, I'm sure.
Yes, sir.
Yeah, big changes there. Mr. Hill, back to you. What is the procedure if a student athlete tests positive for COVID?
Sure. So that school needs to report it to the Office of Public Health and enter that student's name into the Public Office of Health portal. Of course, if it's a football player, that coach or athletic director communicates to the school that they played, or the school or schools that are in the next week or week beyond that, as far as communicating whether or not they'll be able to play. 2 weeks out, 14 days. The contact tracing, of course, is who's the close contact. We've seen changes in that along the way with the CDC, what a close contact is, of course. So there's a lot that goes into play here. It's not just, hey, you tested positive, you need to sit out. That one person is usually come in close contact with their position coach, with the head coach sometimes, other players in their position group, sometimes the entire offense, sometimes in close contact with a opposing player as well. So it really encompasses a lot there when it comes to when you see someone test positive these days. So very small percentage of teams have missed their season's games so far this year. It's been at 4% right now. And when you look at our colleagues around the nation, some of them you're seeing 7 to 10% right now. So you'd like it to be at 0%, but 4% is a nominal number right now.
Okay, Coach Jenkins, I want to ask you something, and quick answer here. If you can give us, we saw the clip from Eunice and the football fans. Recently, the governor has doubled the amount of the attendance that fans can go to games. Has there been a financial impact with the reduced number of fans? Have you seen that?
Definitely a financial impact on athletic departments across the state. And when you talk about wanting to return to play and just get kids back on the field, the fans weren't a big question because you just wanted kids to have that opportunity. But the athletic administrator end of it, you do have to worry about paying some bills, and football pays a lot of them. And to basically reduce your capacity from 3,000, 3,600 to 800 people because of that 25%, it's going to have a big hit on the finances of athletic departments across the state.
And the spirit is definitely there, though. We've seen that all over. Well, that is all the time we have for this segment on prep football and COVID. I want to thank Mr. Held, Coach Jenkins, and George for your input. This fall, COVID has hit college football in a big way. The Southwestern Athletic Conference, which includes Southern and Grambling, has postponed football until the spring. LSU was forced to reschedule a game with Florida earlier this month when several Gator players tested positive. We spoke with Herb Vincent of the Southeastern Conference and also Grambling's head football coach Broderick Fobbs to get their perspectives.
Obviously, COVID-19 has impacted SEC football in a very big way. We had established a new start date to the season But even before that, we had to adjust our preseason practice times. Now that we've gotten into the season, there's a cadence of testing that goes on. In the meantime, they're still practicing all of their safe distancing, social distancing, the wearing of masks, sanitization of our facilities. And so it's a constant daily application of these protocols that has made it a healthy environment for us to be able to participate and to be able to conduct competition.
First kind of heard about, the SWAC maybe possibly postponing, the start of the season, just from phone calls, from our commissioner and then all the coaches involved. Pretty much every conference, has a large amount of African Americans participating in it, not just HBCUs. The difference is having everything in place in order to combat that. Our kids are forced to try to go to school, try to get their schoolwork, but then also deal with the fact that they have loved ones that's sick or loved ones that's passing away. And, and we just feel and we just believe that this was not the time, to try to put student athletes in a situation, especially a physical competitive situation where they can really injure themselves if they're not in the right headspace.
There's a financial impact, number one, from the reduction of number of games that are played, but also the reduced capacities in the stadiums. The financial impact obviously varies from campus to campus, from conference to conference. And so, I'm not sure that we know exactly how that whole financial impact is going to play out.
Recouping the funds, from not playing this fall is it's really a tough deal, and it's part of it. We're hosting a number of games on our website, previous games, where people can go and purchase, opportunities to watch those games. I look forward to competing this particular spring. We start up February the 27th in Dallas, Texas. In the Cotton Bowl. We're looking forward for everyone to come out, grab their tickets, and come be a part of the show.
Joining us now to be a part of our show is our panel. In studio, we have Shelley Mullenix, LSU's Senior Associate Athletic Director in charge of Health and Wellness, and also Dr. Lauren Scott, Professor Emeritus of Economics at LSU. And then joining us remotely is Gabriel Feldman. He is Director of Tulane University's Sports Law Program and Associate Provost for the NCAA Compliance, and Dr. Charles McClelland, Commissioner of the Southwestern Athletic Conference. I want to go to Ms. Mullenix right now. Recently, coaches Nick Saban and Les Miles, who we're so familiar with, tested positive for COVID. What is LSU and the SEC doing to protect its players and also its coaching staff from the COVID-19 virus?
Yeah, so early on, we really started kind of focusing on the educational component. We figured that we're not going to be able to master this virus at all if we don't understand it. So the education component went not only to the student athletes, but to the coaches, to the administration, so that we all really had to be on that same page to ensure that, we would have everyone being able to apply all these intricacies, all the rules equally amongst all the different sports. So education was the first part. The second was really the testing. So securing local providers to be able to do the testing for us. Of course, that morphed eventually into the SEC conference offering a contracted company to come in. So now that there's a company that's basically at every SEC school doing testing at pretty high frequencies, depending on what sport you're in, what time of year you're in. And then the contact tracing component, which I felt early on was probably one of our biggest accomplishments, was being able to really kind of put those puzzle pieces together when you got a positive, to identify those that were associated so that we didn't have further spread. So really those three things I think were the most important part of helping our coaches, who are actually slightly more vulnerable than even our student athletes based on age. And so we were definitely attuned to that early on.
All right, thank you. Dr. Scott, let me ask you this. Besides reduced fan attendance, which is clear, LSU has banned tailgating, limited concessions. Most everything that we know of that goes along with football has changed. So what is the impact financially? What's the impact to the city of Baton Rouge from a hotel's perspective? The entire gamut.
Well, it's a big hit, as it turns out. We did an economic impact study back in 2012 when the stadium was about 10% smaller than it is right now. And even then, over a 7-game season, we estimated that about $250,000 in sales at businesses in the Baton Rouge area, just the Baton Rouge area, were associated with that 7-game season. So that number is probably closer to $300 million. Okay, given the stadium size and the success the program has had lately, it is a really big blow to the athletic department in particular, because if you look at ticket sales for football alone is around $44 million. You put the tradition fund in there, it's another $24 or so million. Parking is another $3 million. Concessions another $3 million almost. You're talking about losing a great deal of money. And not only is that bad for the economy, but if you understand the athletic department, it is football that supports really everything else. Everything else does not make money. The women's sports, for example, softball brings in about $100,000 in ticket sales. I think gymnastics brings in $400,000, but they don't even begin to cover the cost of their operation. So it's a really big hit. It's a very difficult thing for the athletic department to handle. Some of the people, about 27% of the people said we're going to keep our tickets, use them this year. It turned out to be pretty good because 25% occupancy is about what we could have in the stadium. But it's they're going to lose the ticket sales, the other ticket sales from this year. About 50% of the ticket sales, the athletic department gets to keep the money, but it goes into next year's tickets. About 23% of the people said we want our money back for this year. So it's just, I just can't imagine what it's like to be the athletic department head right now. What an amazing puzzle they've got to solve to say solve it.
Yeah, no real certain way to make up for any of that at this point.
No,
to be super creative maybe.
Yeah, they're going to have to be very creative. I think they're going to go into reserves. There's probably going to be some borrowing that takes place among all the SEC schools. And then, of course, there's some cost cuttings that are going on, too, in the athletic department.
Okay, let me go to Commissioner McClellan now. Does the SWAC have any idea on what the conference and SWAC schools are expecting to lose financially this year?
Well, it's going to be in the tens of millions of dollars across our platform. Game guarantees are significant. We're not going to have any of those this year. And again, with our attendance, we've led FCS, as I said before, so a significant amount of our revenue comes from ticket sales. So if each member institution is taking a $2 or $3 million hit, that's a significant amount of revenue coming out of their business.
What are the liability issues, Mr. Feldman, for a university if a player contracts COVID?
Yeah, that's the billion-dollar question. And I think every business in the country that has opened up its doors is asking the same question. And it's not just for the student athletes, it's for the students who are back on campus. But specifically with respect to student athletes, every football player and most athletes in other sports were given the right to opt out of playing, at least in the fall season, and to maintain their scholarship for this year. And we're told of the risks that might be associated with playing. So with that sort of warning and notice, there are a lot of obstacles to any lawsuit that might be brought by a player. And obviously we have that none of the players get sick, and if they do, none of it is serious. But if it does get to the point where a player does try to bring a lawsuit, this would essentially be a tort claim, a negligence claim, where the athlete would have to show that there was a standard of care that's accepted that was not met by the school, so to breach the standard of care, and that breach caused the athlete to contract COVID and then cause him or her harm. And that's difficult at every step of the way. One, to show that there is some accepted standard of care because of all the differences and what the medical protocols are, and then to show that that standard of care was breached, and then make it even more difficult is to show that that breach caused the infection, given that student athletes are students and most of them are on campus and most of them are visiting their friends and going out. How to prove that they caught COVID playing football and not through some other activity?
Let's come back in studio now with a question from Ms. Mullinex. What is the procedure if an LSU athlete gets infected, and how long of a quarantine period has to take place then?
Yeah, so it's quite a process. We talked about all the testing that they're doing in advance, and so student athlete would get a test, and then really within 24 hours we're getting some results at this point. From that time, if you're told that you're positive, we really start what we call the care team, and it involves the registered dietitians that we have as part of the athletic department that are responsible for delivery of food, because now they're in isolation, so they obviously need to eat. The certified athletic trainers that we have are there to basically serve as liaisons between the medical, the physicians, the academic center, because now they've been pulled out of class, and some cases might not be able to even do a Zoom call in. Obviously, communication with the parents is another important part. Moving them physically from where they are currently to where they have to go into isolation, that's a process. We've got one of our senior administrators that does that. And then really our sports psychologists are involved as well to provide that mental health support, because when you put someone in isolation for, usually even 3 or 4 days, it starts to get kind of hairy. So you can imagine 10, 14 days down the road, how difficult that is.
Well, let's talk some numbers now. So if a number of LSU players became infected, what would that number need to be for a game to be postponed? And we look at Florida, for example. This was in a week when their coach was calling for Florida fans to pack their stadium with 90,000, and then that very week they had to postpone the game with LSU because of players being infected.
It's a moving target. So the reason for testing 3 times a week is that you can obviously over the course of time figure out how many more cases you might have. So when there is an outbreak, it tends not to be one person. It's a cluster. And so then you have to ask yourself, through contact tracing, how many people are associated with this isolation case. So you end up with not only the few that are positive, but then you end up with exponentially, a larger amount of people that are in quarantine from the contacts with them. And those student athletes are actually out for 14 days. And so in the case for the University of Florida, you're really talking about 2 weeks, where you're down players. But it's a moving target, and we report every week to the SEC, to one of the commissioners there, to let them know how many people we have that are in the opt-out phase, that are in the positive COVID status phase or quarantine phase, and injury, because you have to have a team. So they've got a formula that got figured out, and if we can meet that formula, then the game goes on.
Well, let me ask you this very quickly. Coach Saban, recently, he was infected, and then 2 days later, he's on the sidelines of the game. How did that take place?
Yeah, it was actually interesting, and it was a result of a rule change that came probably days before. But the testing's not perfect, and we know that. We know that there are better tests than others. So the PCR is the test that is kind of the gold standard, and that's what's being used for these competition type testing. So he got tested, basically is asymptomatic, and has the option now to challenge the test, which is reasonable if you're asymptomatic. It's a frustrating thing to be told you're now locked up for 10 days. So he challenged the test. The first test comes back negative, which is a really good indication that there was obviously a mix-up somewhere, in laboratory error most likely. You let 24 hours go in between each of those tests, and if you can come up with 3 negative PCR tests, you're free to go. And I mean, timing was of the essence for him. Yep, and made the plane trip.
Yeah, absolutely. He was Zooming practice from his house on that one day when he wasn't available. Dr. Scott, legalizing sports betting is going to be on the November ballot as we change up a little bit here. Do you have any idea how much revenue that would bring to the state's general fund if it passes?
Well, we have some examples out there, but a lot depends. All this ballot does is say we can legalize it. Then the legislature has to decide what model you're going to follow. And one example is the Mississippi model. In the Mississippi model, you actually have to go to a brick and mortar casino to place your bet. And as a result, if you look at that, Mississippi does not get very much money off this. In 2019, they got about $3.5 million, which is a drop in the bucket in the sports budget. On the other hand, you have New Jersey. New Jersey basically says if you are within the boundaries of that state and you have a smartphone or an iPad, you can place a bet, okay? And they have actually things on your phone. They have a tool called geofencing or geolocation that makes sure that you are actually within the state of New Jersey, and you can place a bet. And they get about $31.5 million, but they are much richer than we are. They have about double the population we have, and they are surrounded by very populous, rich states. In Louisiana, if we take on that model, one of the things we're going to run into is probably not all parishes want to play the game. When sports fantasy betting was approved, there were 17 parishes that opted out, most of these in the rural northern area of the state. So my guess is we will end up, depending on what model we choose, somewhere between $7 and $21 million. It's really a drop in the bucket. It's not going to be a big thing for the state's budget.
Okay, thank you very much for that. Mr. Feldman, I want to go back to you now. What happens to college athletes who opt out of taking part in their sport due to COVID, and what happens with their scholarships in that respect?
Yeah, well, the divisions got to decide really what the decision was for fall and last spring athletes was they get to maintain the scholarship whether they play or not. And the rule that was just passed relatively recently was that even for athletes who choose to play in the fall, they still get an additional year of eligibility next year. And it's designed in part to make the decision easier about whether to play or not, and also to deal with any situations where there are shorter seasons or just minimized opportunities that the athlete would normally get, which is great for the athletes. It's going to create some complications for the athletic departments next year when they have their incoming year class, and basically a double class because of the athletes who stay for that additional year. There is no guarantee of the scholarship for that following year. So there'll be some decisions that the athletes have to make. But the same decision was made in spring sports. The only athletes who didn't get that additional year of eligibility were the winter sport athletes from last year, and most notably were the college basketball players.
Commissioner McClelland, back to you now. Despite all the challenges that COVID has created for college football and our lives, are there any positives that you see coming out of this experience?
Within the Southwestern Athletic Conference, yes. It's put us on a cohesive path with our 10 member institutions. Everybody's on the same page. It's given us opportunity to concentrate strictly on academics, and the health and safety of our student athletes has given us a great opportunity to create some new rules that's going to help us in the future to ensure that we take care of all of our student athletes in the proper way that they're supposed to take care of.
Thank you, sir, for that. And everyone, that's all the time we have for this segment. I want to thanks very much to Ms. Mullinex, Dr. Scott, Mr. Feldman, and Commissioner McClelland for their input. And when it comes to professional football, the NFL has outperformed the national infection rate through its COVID protocols. But the Tennessee Titans' 24-person outbreak has prompted the league to plead for renewed vigilance. We spoke with epidemiologist Zach Binney. He's with Emory University about his concerns for pro players. The league has laid out an entire plan for pumping fake crowd sounds into stadiums and during broadcasts, tailored for each team, reactive to plays, and at specific decibel levels.
If I were a player, my number one concern would be not making myself a case where I could spread it to my family or other members of my community. I think there are certainly some lessons that the rest of the country can take insofar as the NFL has been testing everybody very frequently, and that has allowed them to catch cases as soon as they occur, and in most cases, keep those isolated. So you haven't seen one case turn into a big outbreak, except on the Tennessee Titans. The idea is not and has never been in most places to get to know COVID-19 cases. It has been to keep them at a very low level and maintain that low level so that not a lot of people die and our health system doesn't get overwhelmed as we wait for a vaccine, which will hopefully be here within the next few months.
Helping us now explore the changes to pro football in Louisiana, I am joined again by Dr. Lawrence Scott. Here in the studio, Gabriel Feldman, sports law, and remotely from Tulane. He is sports law at Tulane. And the epidemiologist we just heard from, Dr. Zach Binney, who teaches at Oxford College at Emory University in Atlanta, has also consulted in the past with the NFL and the NCAA. And Dr. Binney, I'd like to start with you first. As someone who studies sports and public health, what are the ramifications of a return to football during a pandemic?
Well, I think the number one thing that every sport needs to be concerned about is it contributing to a worse public health situation? So we often focus on the players and coaches and keeping them safe. And of course, that's important. I'm not saying it's not. But more to the point, we also need to be worried about, are we generating more cases that could go into the community? And unfortunately, we have seen, for example, with a high school team in Kentucky and elsewhere, we have seen the virus spread through those teams and then progress into people's families and into the community. And so you're creating more cases than there otherwise would have been. In the pros, there have been fewer cases, and they seem to have stayed more isolated, so that's good. But you always want to think about the impact you're having on public health. I would take that as a point broader than just sports, by the way. Any step that we want to take back towards normality, be it football or Thanksgiving or opening bars or restaurants, we need to weigh the benefits and the risks. What risks are we adding in terms of public health and viral spread, and what benefits are we getting for that? And we want to make sure that the benefits always outweigh the risks. That's how I think about bringing sports back and how that relates to public health.
Thank you, sir. Mr. Feldman, to you now. Last week it was announced that the Las Vegas Raiders are under review for violating the NFL's pandemic protocols. Among the infractions cited is a player who removed his electronic tracking device. Can you explain exactly what these devices are for?
Yeah, it's for, as Zach talked about, to try to minimize the spread of COVID. And one way we know COVID is spread is through close contact. And so these devices help identify who players have been in close contact with. And the idea is if you take the device off, it is then difficult to track who you've been in close contact with. And contact tracing has been a challenge for us in the country and in the world. And this is the NFL has the resources to be able to provide these devices to try to trace who people have had close contacts with. And so what we've seen from the NFL, not only with the Raiders, but also with the Titans, is discipline if anyone violates the NFL's COVID protocols. And what we've seen with the Raiders is, given the repeat offenses, that the league has now threatened that a team will forfeit the game if they have to miss the game because of a violation of the COVID protocol.
All right, Mr. Feldman, what are the fines? How big are the fines that the players, even the coaches, are facing for breaking NFL protocols? You mentioned forfeiting a game there, but what about in terms of money?
So it depends on whether it's a first offense or second offense, but essentially if you're not wearing a mask, if you're not practicing social distancing, then the fines are anywhere from $50,000 to $250,000. Some are for the players, some are for the team, but the league is really putting the onus on the team to enforce the protocols and less so on the individual players. But so it's monetary fines. There's also a possible loss of draft picks, and as I mentioned, potential forfeiture of a game.
All right, sir. Thank you very much for that. Dr. Scott, let's go to you. At the beginning of the month, just the past several weeks, the Saints had talked about moving their games to Tiger Stadium, where they could have some attendance, albeit 25%. But ultimately, the mayor, Cantrell there, decided to keep in the Superdome. They had 3,000 fans at their game this past week. So what kind of economic impact would that mean for either city?
Well, the main thing for would be the impact on Baton Rouge. So you're bringing that money up here. Now, as it turns out, as I understand that agreement, the Saints are going to get all the ticket revenue. LSU is going to get the parking and concession revenue. And if you kind of look at that, where you have only 25% full of the stadium, we're really only talking about a couple $100,000 that LSU would gain directly from that. Now, the other thing is the fan spending. You are bringing fans into the area, so they're going to go to our restaurants. Maybe some of them stay at our hotels and that sort of thing. And we're talking probably somewhere in the neighborhood of $1 to $2 million in extra spending that will take place at those hotels, I think, which is not a whole lot of money unless you're walk-ons, right there next to the stadium. Then that's, given this environment, that's a lot of money for them.
But it seems like right now that's going to be a moot point.
It looks like it's going to be a moot point. Looks like the mayor down there is conceding a little bit, letting more people come into the stadium. But, not having people in that stadium in New Orleans and visitors not coming down and staying in hotels has really hammered New Orleans. New Orleans has taken a big hit. There have been at least 72 conventions that have been canceled. So they're really having a hard time even without this problem.
Right, in every respect, having a tough time. Dr. Benny, to you, do you feel that NFL players are being kept safe this season? And what, in your opinion, is a safe environment for players and coaches during this pandemic?
Yeah, so the right way to think about that question is to compare how many players and coaches and other team personnel, like scouts and medical staff and athletic trainers and so on, how many of them are getting sick now that the season is ongoing versus how many of them would have gotten sick if we weren't playing football. And frankly, when you compare the number of cases that we've seen in the NFL during the season, to the percentage of these folks who would have gotten sick were they not in the NFL by just looking at people who aren't in the NFL and using them to stand in for what would have happened absent the season, we actually see that the NFL seems to be creating a pretty safe environment in terms of the number of cases that we've seen. Their plan was never to have 0 cases, and I didn't think that was necessary in order to create what you might call a safe environment, which is simply to have a lower rate of viral spread within the league, given that the season is happening, than you would have seen among these people if the season weren't happening. And I think they have achieved that so far.
Let me ask you this, Dr. Benny. I understand you have some concerns about a decision to allow fans to attend games. So your thoughts on that?
Yeah, I do. So like I said earlier, everything has a risk and a benefit associated with it. And I understand the benefit of bringing football back or bringing sports back more generally. It's a huge psychological boost for people. It can be a huge economic driver. And you can do it, as many pro leagues have shown, at least at the professional level with the resources they have available to them, in a relatively safe way. Where you lose me is when you start talking about adding fans. I certainly understand, to Dr. Scott's point, that it adds some revenue, and there's a lot of need for revenue, particularly in the New Orleans area right now. And that's why a smart, holistic response to the pandemic would have included dealing with that issue and providing, hopefully, federal support, given that we're the richest country in the history of the world, to help offset that economic pain from not being able to gather in large numbers indoors. And so I think you have to think, what are really the benefits we're getting specifically from fans, and how does that stack up against the risks? And especially down there in New Orleans in the Superdome, I'm sorry to say, I really don't think we should be having large indoor gatherings right now, given the state of the pandemic in the U.S. It's just not a smart idea.
Okay, so they had 3,000 fans at the most recent game. I'm not sure what your thought is about that number, but I also would ask you about concern for fans at outdoor stadiums as well. What about that, sir?
Yeah, so let's start with the 3,000 number. Obviously, that is a small percentage of the Superdome's overall capacity. It depends a little bit on how they were spread out, right? If they're spread out through the entire stadium, then maybe that's not a super large amount of risk, even though they're indoors, especially if most people are wearing masks most of the time, which we know slows down transmission. But then you have to ask yourself, like, why even 3,000 at that point, or 6,000? Why can't we just stay at 0 to maximize the safety there, while still, allowing the season to proceed and at least generating some revenue that way? Certainly, outdoor stadiums are less concerning, but depending on the number of people that you're gathering and how they're distributed in the stadium and how many of them are wearing masks, it's certainly no guarantee that we're not going to see spread from those games. And then again, we have to ask ourselves, is that really worth it? We've seen outbreaks, for example, at some presidential campaign rallies, some of which have been outdoors, so that's not a complete guarantee. And we also have to think about what 25% capacity, say, really means, because that doesn't necessarily mean every section of the stadium is open. If you're at 25% capacity but everybody's in the lower bowl, hey, guess what? That's actually 50% capacity. So people also need to think a little bit more carefully about how people are spread out and how much mask wearing there is, because the more we can get, the lower we can drive that risk.
All right, sir, thank you for that. Mr. Feldman, let me go to you now. For pro football players who have opted out of playing this season, what kind of impact does that have on their contracts and on their salaries?
So players there were 2 categories. One were high-risk players, as defined by a pre-existing condition under the CDC, and they were given $350,000 if they opted out, and this would count as a year played, and they were just given $350,000 instead of their salary. So if they had 3 years left on the contract after this year, they'd have 2 years left on their contract. For non-high-risk players, they were given $150,000, but this year it's as if it did not exist, which I think for a lot of us wish were actually the case. But if they had 3 years left on their deal and they're not high risk, they get $150,000, but they still have 3 years left on their contract, and the $150,000 is basically in advance on their salary that they'll earn next year. the majority of players, a significant majority of players who opted out, fell into that non-high risk category. So their contract is essentially told for a year and will pick up back next year.
All right, sir. Thank you for that. Dr. Benny, let me ask you this. Playing devil's advocate, since the survivability of people in the age group of most NFL players exceeds 99%, are we erring too much on the side of caution and to the detriment of the game? Your thoughts on that?
Yeah, look, Andre, it's a great question. I have two responses to that. Number one is that the cases aren't just going to be among players. We've seen, especially at the youth and high school level, cases that may start on a team don't stay on a team. Just like cases that start on a college campus don't stay on a college campus. They spread into the broader community, and they can affect people's parents, people's grandparents. So we can't just focus on the mortality rate among football players or even coaches and support staff, which, by the way, isn't zero. We have seen now multiple high school and college athletes, in fact, die from COVID-19. The other thing to think about is that it's not just about death, okay? There can be a lot of outcomes in between complete recovery and dying. For example, you could have long-term heart or lung effects. And now if I lose 5 or 10% of my heart or lung function, my 5K time goes from 40 minutes to 45 minutes, right? Who cares? The most strenuous thing I do is stand up and talk in front of students for an hour. But if an elite football player, for example, loses 5 or 10% of his heart or lung capacity, his career is done, potentially. So we also need to think about those sorts of intermediate outcomes.
All right, sir, thank you for that. Mr. Feldman, another question. Has the reconfiguring of the NFL season affected sports bodies and their TV network partners? How's that happened?
Well, it's interesting because the NFL is in a different position than most other sports leagues because of their massive national television contract. The team's revenues, each individual team's revenues, a much higher percentage of it comes from TV deals than ticket sales or other sources of revenue, in part, again, because of the massive TV deal, but also in part because there are only 8 regular season home games for each team. So the NFL has been able to handle this, at least economically, better than most other leagues. We saw the report from Major League Baseball yesterday that they may lose about $8 billion because of the pandemic. And the NFL will not only not lose nearly that much because of their TV deals, and again, the lesser reliance on ticket sales, but they're already talking to their television partners about the new deals they will negotiate at the end of next year, and the expectation is they will be back on track to get about $25 billion in revenue per year, largely from their TV deal. So football, although ratings for all television appear to be down this year, I think we expected the ratings might bump up because people were stuck at home. But with sports ratings, we're seeing them down across the board. The NFL is not quite down as much as the other leagues, but there is still no question that the NFL on football is still king. People still want to watch their football. They still want to watch it live. Advertisers still want to be on those shows. So the NFL will rebound just fine, assuming we get back to relatively normal soon, and their TV partners will, as usual, be vying to compete to show their games on air or on their streaming platforms or wherever else we might consume television, football in the next few years.
And what a huge question that is, getting back to relatively normal soon, right? Well, everyone, we have run out of time for our discussion tonight. I want to thank Dr. Scott, Mr. Feldman, and Dr. Benny, and everyone who took part for their input. And we encourage you at home to comment on tonight's show on Louisiana Public Square's Facebook or Twitter accounts. You can also visit lpb.org/Public Square and just click on the Join the Conversation link. Thanks everyone for watching, and good night.
For a copy of this program, call 1-800-973-7246 or go online to www.lpb.org.